Hi, I'm Sabrina, and this is a lentil. It's the size of your fetus at 6 weeks, and it's also the size that Texas lawmakers have banned abortion at, which most women don't even realize that they're pregnant at that point. Reproductive care is primary care for women. It's not just about abortions. It's about sexual education, health, safety, and human rights. I've conducted research on Planned Parenthood for quite some time now with videos, essays, as well as published articles, and I'm committing most of my college education to sexual and health sciences. So yeah, we'll first discuss pregnancy misconceptions as well as pregnancy crisis centers. Next, I will discuss abortions and the different types of abortions that there are. And lastly, I will discuss Planned Parenthood and all of the services that they provide for our community, as well as ways to help keep them afloat. But first, I will discuss the Heartbeat Bill. As of May 19th, 2021, Texas lawmakers have since passed a bill outlawing abortions at 6 weeks, and it's effective in September. The bill makes abortion illegal as soon as a fetal heartbeat is detected, which can happen as soon as 6 weeks. According to a 2021 article by the Texas Tribune, Dinah Limon Mercado states that when you factor in the time it takes to confirm a pregnancy, consider your options to make an informed decision and schedule an appointment to comply with all of the restrictions politicians have already put into place. A 6-week ban essentially bans abortion outright. While it is possible to get an abortion before that period, most at-home pregnancy tests aren't accurate until 5 weeks of pregnancy, which is far too early to really recognize as a pregnancy because early pregnancy symptoms are often confused for period symptoms. Many women who are seeking help from an abortion clinic are misled by pregnancy crisis centers whose only purpose is to guilt or force them into having the baby full term. Many crisis pregnancy centers, or CPCs, deliver false information about the baby's size and force the expectant mothers to listen to the heartbeat and watch an ultrasound of the fetus inside. During a 2010 interview, Dr. Ann Davis stated that CPCs can lead the mother with information regarding the abortion can occur up to term, or that they have plenty of time to decide when the abortion can actually occur, only for the mother to find out that it is far too late for the baby to actually be aborted and they have no choice but to keep it. Which there's also no law in place stating that the CPCs have to give out accurate medical information or even be led by a healthcare provider, which means that a random person on the street can give you an ultrasound and provide you information about your baby, whether it's accurate or not. There are many reasons why a mother may want to have an abortion. Maybe they have kids already and aren't financially in a place to have another child, or maybe they're just too young and don't think they can take on the responsibility of motherhood. Now that I've discussed laws against abortion and some misconceptions about the fetus's life, I'd like to discuss some different types of abortions available. There are 2 types of abortions: the in-clinic and at-home abortion. In-clinic abortions are also referred to as surgical abortions, which a doctor actually does the procedure of putting the patient under and sedating them and using a vacuum to suck the fetus gently out of the uterus, or sometimes they use surgical tools as well. The second type is a pill form, which takes place in 2 different pills and can be taken up to 11 weeks of pregnancy. The first pill prevents the growth of the fetus, and the second pill flushes out the uterus. Each procedure is compared to a miscarriage or a very heavy menstruation, and both are just as important of knowing for the education of your choice and options. Now that we understand how abortions work, there are many different types of ways that Planned Parenthood has helped us, and I'd like to discuss some misconceptions. First, and the only misconception is Planned Parenthood isn't just for abortions. It's for men and women as well. For men, they can receive STD testing and treatment, as well as information about sexual care, cancer, infertility, erectile dysfunction, routine checkups, and also provide accurate sexual education for those in need. They also provide regular primary healthcare services, breast cancer screenings, screenings for cholesterol, and they even provide hormone therapy to transgender patients. Defunding Planned Parenthood would not just block abortion rights or access, it also blocks access to those in need of primary care resources to lower class individuals. According to the ACP, Journal of Internal Medicine, patients, communities, and providers all benefit when there are more accessible care options. They also provide very detailed videos explaining how birth control works, the different types of birth controls, and any other sexual question that you may have about your body. Furthermore, according to a 2017 study article by C. Hall Lawrence published in the Annals of Internal Medicine, Planned Parenthood has been helping communities for over 100 years with safe and affordable healthcare. In this presentation, I described a new law that was passed to prevent the access to healthcare, different types of birth control, as well as the services Planned Parenthood provides to our community. Reproductive care is not just care for women, reproductive care is care for women. It's not just about abortions, it's about sexual care, sexual education, health, safety, and human rights. In conclusion, I hope you learned a lot about the services provided by Planned Parenthood, as well as answer some misconceptions about abortion. I hope you can use this information to help and educate others around you. If you would like to support Planned Parenthood, please visit donate to plannedparenthood.action.org or call 1-855-789-7723. Or if you can't donate, share to whoever you can. All the information provided is also on plannedparenthood.org as well as on their Instagram page. Thank you.